Hi.
Sounds good. Martha, whenever you're ready.
Okay, I'm ready. Welcome to the New York Academy of Medicine. My name is Dr. Martha Adams Sullivan, and I'm a fellow of the New York Academy of Medicine and vice chair of the Healthy Aging Section. I'm also the founding chair of the Citywide Behavioral Health Coalition for Black Elders, Inc., and executive director of the Creedmoor Psychiatric Center. Here at NYAM, we are champions for health equity. Our vision is a world where everyone has the opportunity to live a healthy life. NYAM's drive for health equity for all has never been more vital. Because we believe that health equity is deeply tied to systemic racism, we actively tackle the issues that are important for social justice in order to advance our mission and to promote our vision. Through scholarly, community, and public engagement, we work together to build a more equitable and healthier world for all. So today we are excited to bring you this program, Equity Checkup, practical tips for meeting the needs of diverse older patients and family caregivers. You will hear from Ilana Kiefer, who is acting director here at NYAM's Center for Healthy Aging, and from Lauren Pongan, National Director at the Diverse Elders Coalition. If you would like to ask a question or make a comment at any point, just click on the bubble icon labeled Q&A. It's at the bottom of your screen. Your questions will be shared only with the panelists. We will address as many questions as we can at the end of the presentation. As you do so, if you would please tell us where you are from, that would also be great. We've also enabled closed captioning for the webinar, so you can access it by clicking on the live transcript button. That's also on the bottom of your screen, or you can turn on and off the subtitles. For any technical issues, please message Michael Canfora on Zoom. So thank you for attending. We look forward to a lively presentation, and I will turn it over to Ilana Kiefer.
Thank you, Dr. Sullivan. And hello, everyone. I am zooming in from New York City, and I apologize in advance if you hear any New York City noises from the street, but hopefully my AirPods are high quality enough that you won't. So I just want to thank you all for joining us today. And we can go to the next slide, Joey. All right. So before we get into the meat of our session, I just want to make note that this year in 2022 is the New York Academy of Medicine's 175th anniversary. And if you receive our emails and follow us on social media, you will see that we are doing a whole year-long's worth of events celebrating this historic milestone. And we hope that you will tune in throughout the year 2022 as we celebrate this. Next slide, please. So what we're going to do today, we have a lot packed into a short 60 minutes, but we will do it. We're going to first give you an overview of who our organizations are and why we're talking to you today. And then I'm going to do a very brief overview of demographics of diverse older adults in the US. And then I'm just going to give you some practical tips, as the session is called, for healthcare providers and others who work with diverse older patients. And these tips really just skim the surface. We know that you all probably have a lot of ideas yourselves, but we're just giving you a few things to think about, many of which you may already know. And then we're going to hear from Lauren at Diverse Elders Coalition, who's going to talk kind of more about the family caregiver side and share some personal stories of family caregivers. And then we'll give you some resources to use. And then, of course, after the session, we'll be sending out both the recording, the slides, and the slides you'll see have many hyperlinks that go to various resources. So we hope that this is both educational and useful and practical. And next slide, please. Next slide. So I imagine many of you on the call have been to a NYAM webinar before, but in case you have not, I'll tell you briefly about us. At the New York Academy of Medicine, our mission is to drive progress towards improved health through attaining health equity. And we do this through 3 different ways. We have our Fellows Program, which is one of the hosts for today's session. And the Fellows Program is a network of over 2,000 experts, including Dr. Sullivan, across the medical, public health, and social work professions. We also have a world-class medical history library, and they've been very busy in the last year preparing for our 175th anniversary. And then we have a wide range of research, evaluation, and policy programs on a variety of health equity issues. Next slide. And specifically, I work at the Center for Healthy Aging, where our mission is to improve the health and well-being of current and future aging populations. You can see here listed what our goals are, and then also how we aim to achieve these goals. And we're gonna go right to the next slide, please. One of the programs that we run within the Center for Healthy Aging is the Older Adults Equity Collaborative. This is an initiative that's funded by the Administration for Community Living, ACL, formerly known as the Administration on Aging. So it's a federal agency, and they work with us to convene national nonprofit organizations all across the country that are committed to aging and minority populations. I'm just going to very briefly name the 5 organizations that we are lucky to work with in this collaborative, and you can learn a lot more about them on our OAEC resource library. So the 5 organizations, and I saw in the Zoom list, some people are here representing those organizations are, and you can follow along in our little logo, NYCOA, the National Indian Council on Aging, NAPCA, the National Asian Pacific Center on Aging, NCBA, the National Center for Black Aging, SAGE, the National Resource Center on LGBT Aging, and MHP Salud, who are supporting older Latino adults. And you'll see when Lauren talks about her organization that there's a lot of crossover with these organizations. Next slide, please. And Lauren, if you just want to get on the camera momentarily and tell us about DEC.
Sure. Thanks, Elena. Hi, everyone. Good afternoon or good evening, depending on what time zone you're in. My name is Lauren Pongin. I use she and her pronouns, and I'm the National Director at Diverse Elders Coalition. At the Diverse Elders Coalition, we advocate for policies and programs that improve aging in our communities as racially and ethnically diverse people, American Indian and Alaska Natives, and LGBTQ plus older adults. Next slide, please. Oh, maybe one slide back then.
The other way.
Backward toward my org, thanks. Oh, So as we land on the slide with the Diverse Elders Coalition logo, I'll just go over that. As mentioned, there's a lot of overlap between the Diverse Elders Coalition and NYAM's work in the Older Adult Equity Collaborative. I'm not sure if I got the acronym right for that, but we work with the National Asian Pacific Center on Aging, the National Caucasus Center on Black Aging, the National Indian Council on Aging, and SAGE, which all have national resource centers for their demographics under ACL. Our other 2 member organizations are CRAC, the Southeast Asia Resource Action Center, and the National Hispanic Council on Aging. And all of our organizations are national organizations that all have a strong focus on aging. 5 out of 6 of us are aging organizations themselves, with the exception of CRAC. But everyone, all of the organizations involved have a strong emphasis on aging and equity and are committed through the coalition's work to intersectional advocacy opportunities that benefit diverse communities. Turn it back to you.
Thank you. Joey, you can go to the next slide. Great, thank you. And then one more, please. So now that you have a sense of why Lauren and I are talking to you today, we're going to do, again, as I said, a very brief overview, not comprehensive at all, of some demographics of adults age 65 and older in the US. So as you can see here, fully 20% of older adults are people of color and or American Indian or Alaska Native today. About 37% of LGBT adults of all ages are over the age of 65. And we at NYAM are based in New York City in East Harlem. And so just to give a little kind of some data on New York City, fully almost half of adults age 65 plus in New York City alone, identify as Black, Latino, or Asian. So obviously, this is a very, very large population. And so we want to make sure that we are doing what we can in the aging community to best serve the needs of these populations. And next slide, please. Thank you. Just go back one. Thank you. So, and this will continue and this will grow in the coming years. So in the next decade alone, fully 20% of the entire US population will be age 65 and older, which is probably not a surprise to anyone that has come to our past Center for Healthy Aging webinars. And also specifically for today, 30% of older Americans in the next 10 years will identify as diverse and or underrepresented. And I just want to make one note. We are using the term diverse. There are many different terms that people use when we're talking about these subpopulations. We could have many webinars on what those different terms mean. But just for the kind of sake of clarity for today, we'll typically be using the term diverse. Next slide, please. All right. So now we're just gonna, again, we could do a webinar on probably each one of these numbers, but I'm just gonna very briefly go through some different kind of dynamics of some of these demographics that you can see. So just click once. All right, so fully 78%, which is a very high number of LGBT older adults go back into the closet and therefore, don't refer to themselves as LGBT when entering a nursing home or another long-term care facility, which is, in my mind, very problematic. Next click. In about less than 40 years, 20% of all adults 65 and older will be Latinos. So we want to be thinking about that in terms of language and other issues as well. Next click. There are about 100 languages spoken among the AAPI, or Asian American Pacific Islander population. So again, when we think about language, we're not, for instance, just thinking about Mandarin or Cantonese. There are really 100 different languages that, and that also means many, many, many different cultures within the AAPI population that we want to be considering. Next click. More than a third of African-American older adults are responsible for raising their grandchildren. And this, of course, brings many challenges, and it also brings many opportunities, as we are certainly very kind of aware of and excited about many intergenerational opportunities. But of course, it can also be quite challenging. One more click. And I find when we speak about diverse aging, we often don't talk enough about the Native American population, but you may be surprised to know, as I was when I read this, that Over 500,000 Native Americans are over the age of 65. And even though it's not a huge number in New York where we are, or where I am, you can see here that they're concentrated, although they are certainly in New York and probably in all the states, but they are concentrated in the states of Oklahoma, Arizona, California, New Mexico, North Carolina, and Texas. All right, so just let that seep in and we'll go to the next slide, please. And then one more. So we're just going to talk very briefly. As I said, these are probably things that many of you are already doing if you are healthcare providers, if you work in a healthcare setting, but we just want to kind of ensure that these things are happening. So whenever anyone starts with a new provider or something changes demographically or anything related to that, we all complete intake forms on a regular basis, and we hope that those intake forms are inclusive. And there are many ways that they can be inclusive. The two that I'm just going to point out today relate to family caregivers, as well as SOGI, which is sexual orientation and gender identity. So when we talk about family caregivers, especially when it comes to older adults, it's often important that, and often common, that another adult will be involved in that patient's care in some way, shape, or form. And that person may be a spouse, it may be an adult child, it may be a nephew, it may be a neighbor, it may be, a friend of 60 years. There are so many different types of people, of course, that can be caregivers. And so we just encourage you, as you're kind of looking at the forms that you give out or that you have on your tablets, to ensure that the kind of different options for categories of either caregivers and or emergency contacts are wide and inclusive, and that you as a healthcare provider know what that relationship is, who you're calling if you need to make a call to a caregiver or emergency contact, and know that those people might be outside of what we think of as the traditional family structure. And in terms of SOGI, we do hope that you are asking questions about one's sexual orientation and gender identity, just because it's the respectful and right thing to do, but also to better understand the needs of your patients. And we hope that you will, of course, use the words that the patient uses on those forms and when they speak to you, and reflect that back when you're talking with them and or their caregivers and with other providers. You'll see here there's a link to a very good kind of toolkit on ensuring that your forms and policies create an inclusive environment for LGBT patients of all ages. And I encourage you to check that out. Next slide. So I know this is kind of small, I apologize, but this is just one example of a very inclusive form that I found from the Callan Lord Community Health Center. So you can see on the top that it has preferred pronouns. And then in terms of gender identity, sexual orientation, race, ethnicity, and then some other things that we haven't yet talked about related to housing status. There are many different options. It is certainly not comprehensive, but what I like about this form is that it really does allow for a fair amount of options for patients to choose when they're completing these intake forms. So you can access that form if you want to use that as a guide, and I encourage you to think about that. Next slide, please. All right. So I imagine if many of you, let's say, are healthcare providers, some of you are probably not, but we all make referrals on a regular basis. Certainly in the medical field, if you're a PCP and you need to refer someone to a cardiologist, you make that referral. But we hope that you also know about different community-based organizations, or CBOs, that you can make referrals to for a variety of reasons and issues. So there are, of course, many different CBOs all across the country that cater to and specialize in different diverse populations, whether it's age specific or not. And not only is it helpful to be able to refer to them for a variety of reasons if things come up, but also if you want to be able to make connections with local professionals who can help inform you. So let's say that you're planning, let's say that you are a cardiologist and you're planning some type of like 6-week course on staying heart healthy, and you work in a community that is predominantly Cambodian. And so I would just recommend that you look for, and you can actually use this resource locator I'll tell you about in a moment, to find a local Cambodian or AAPI organization that can work with you to ensure that the information you're giving is culturally appropriate. Perhaps if you need some things translated, that you just know where there are resources around. So I'm just going to very briefly go through these different resources. So the NAPCA helpline, there are both phone numbers available and of course online. As I mentioned, NAPCA is the National Asian Pacific Center on Aging. And this map, which again, you can click on, will in various regions across the US, there are lists of CBOs that specialize in different AAPI populations. The one in the middle is specific to New York City, so it's a guide to CBOs for immigrants, but I am sure that there are similar guides around the country. And then the one on the right-hand side is by one of our other partners in the collaborative, SAGE, and this is an online resource, and you can click on any state and find different LGBT-friendly service providers. So if you need to make a referral to an LGBT patient on a variety of topics, you can look here and ensure that that referral will, as it says, be LGBT friendly. Okay, next slide. So of course we can't talk about being culturally sensitive and appropriate without talking about language. And so there are just a couple of different things here to note. You want to just, if you have healthcare materials, education materials that you're emailing out, that you're handing out in person, when you're giving some type of program or talk, you want to just ensure that your materials have images that reflect your patient populations. Just again, using the example of, let's say, living in a neighborhood or an area, or working in an area that has a high, let's say, Cambodian population. And then also this again is kind of stating the obvious, but ensuring that the materials are written in the languages that your patient populations speak. And of course, we recognize, especially in a city like New York, where there's probably well over 100 languages, being spoken at this moment. We know you'll not be able to provide materials in all of those languages, but if you kind of know that you have a large number of a particular language, that there are resources out there for written and verbal translation. And of course, there's also certain federal requirements for providing translated services as well. And I just want to point you to, I found this on the CDC website. There is a ton of information and flyers in more languages than I even knew existed, specifically about COVID. So this flyer in particular is in Haitian Creole, just as one example. And you can also, when you make those connections to the CBOs that I mentioned in the slide before, they may have ideas of where to find materials that are, again, culturally sensitive, and may also have people that can help with translation, or at least to point you in the right direction. Next slide. So the other thing to keep in mind is that we definitely want to ensure that your materials, are really kind of that people of all different educational backgrounds can access the health information, because if they're not able to understand it for a variety of reasons, then the health information is not going to be of much use to them. So we typically recommend that you want your materials to be written at a 6th grade or lower reading level. Of course, there's obviously wiggle room on that. But I know it's kind of small here, but one thing that I learned in preparing for this webinar is that in Microsoft Word, there is actually a program where you can determine what the reading level is of whatever material you have in your Word document. So in this example, I copied and pasted a COVID information for patients who are on dialysis. And then I took it through this process, and the instructions you'll see when you click here will help you with that, will show you what the reading level is. So for example, in this particular example, I found out that this document was for an 8th or 9th grade reading level, so easily understood by people who have completed those those grades people completed those grades. And again, this is an English document, so those grades in English. So just know that this is a free resource on Microsoft Word. We encourage you to use it. I can tell you at our team at the Center for Healthy Aging, we will be using this a lot more now. Next slide. All right, so now I'm going to take a little break, but you'll see me again soon, and I'm going to turn it over to Lauren.
Thank you. So I get, not that that wasn't fun, but I get sort of the fun part of adding kind of the human element to what's important to diverse family caregivers in that aspect. So next slide, please. So one of our biggest advocacy pushes is just really wanting providers and health and social services providers, et cetera, to understand what the caregiving experience is like for folks from diverse communities. So as mentioned in the beginning, none of this is exhaustive or supposed to sum up everyone's experiences, but wanted to give you a taste of just a couple of folks' different experiences in caregiving. So one person that we got to talk to was Melanie, and she's a member of the Millie Lax Band of Ojibwe in the Minnesota region. So I won't read this to you all, but it's available in our report, which there's a link to later. But essentially and I got to meet Melanie at a in-person focus group hosted by the National Indian Council on Aging. And just to understand some of the unique needs of an American Indian caregiver, again, not as a representative experience, just as an example of her individual experience, but she has been a care provider for not only for many members of her family and tribe. So she was a caregiver for her mother and her sister, and is currently a caregiver for her brother. Her brother is living in tribal assisted living, but because of just a lack of comfort and feeling safe around the COVID-19 pandemic, Melanie and her sister perform basically all of the medical tasks. Michael, I'm hearing a little bit of background noise, just to let you know. But Melanie and her sister provide all of the specialized tasks, care for her brother. So these are things, straight medical tasks that they haven't received training or support for, such as administering medication through a stomach tube, etc. I think that in Melanie's case, what she shared with us was that caring for her family members, her mother and her brother, was her responsibility. So again, like we see in a lot of the communities that the Diverse Elders Coalition works with, she didn't really self-identify as a caregiver. It just felt like part of what was expected and culturally accepted for her to be doing. She also mentioned that she has started petitioning her reservation to provide more support for long-term care and families that can't manage on her own. So Melanie has really taken an active role in the advocacy side, as well as pushing for governments from sovereign tribal governments to the US federal and local government to pass legislation for caregivers, including paid family leave, and to make more culturally appropriate services, so that if Melanie or other tribal caregivers want to tap into formal services outside of reservations or tribes, that they are offering services that are culturally responsive. Next slide, please. So before we go into this video, I'm very excited to share this video with you. We're just going to watch for about 5 minutes, but some background, because I really wanted to share the entire video, but it's 20 minutes or so. But I am going to pre-introduce you all to Sharon and Hampton Conway. They are community members who we were connected to through the National Caucus and Center on Black Aging, one of our members, and a NYAM member as well. Sharon and Hampton have been married for many years. And while Hampton was a caregiver to Sharon early on in their relationship, more recently, after a cross-country motorcycle trip, Sharon became Hampton's caregiver after he lost his arm in a tractor-trailer accident. So she's been a caregiver to him for years as he's kind of navigated having only one arm, but she's sharing in this clip some of her experience when recently Hampton needed additional surgery, and she sort of became his more full-time caregiver. So we'll watch about 5 minutes of this, and I can follow up on any questions you all may have.
Joey, I think it was at minute 31.
The link should have brought us directly to the starting point, but
Yeah, okay.
but
So
it should be starting at 31:30, watching until 36:18.
Up this year,
Perfect.
I had to have my right shoulder replaced. You know, and for at least 4 weeks,
6 weeks.
6 weeks.
Yes.
Okay, my right arm was secured to my side and resting on in my stomach area. I couldn't move it. I could not do anything for myself. I couldn't feed myself. I couldn't brush my own teeth. I couldn't wipe my own behind. Okay, my beloved here took care of all of that for me. I was a 263-pound baby, but we got through it. Thanks be to God, we got through it. Everything is well.
It showed me in that time period where he was totally unable to help himself. It gave me a deeper respect for a lot of caregivers who find themselves in that, and their care recipient does not get better. And they don't get the feedback socially. They don't get a respite because it's very isolating. During that time, we had two of his brothers who came in and took care of him. They fed him and and I told people, please call him. We didn't have any visitors because of COVID, but I said, please call him to keep him on the phone because he was trying to do too much. And I knew if he was talking on the phone, he couldn't do anything else. And I bought a chair for him. I don't think they can see your chair, but it was a chair that made him go all the way back. And what I would do is I would put him in the chair, push the button so it would lean him all the way back so he couldn't get out. And because he kept getting into stuff. And so
I just wanted to help y'all.
I know, baby. I know, honey.
I'm not a guy who has to be taken care of. I'm a guy that will take care of you. And I wanted to make the responsibility she had on me as easy as possible.
And some of that came out in frustration where he would snap at me and get angry with me. And I had to be understand that his frustration with his condition, yeah, baby, I'm talking, professionally now. But his frustration with his condition caused him to lash out at me. I'm not a baby. Stop treating me like a baby. I can do this myself. And he couldn't do it by himself. And he'd make a mess trying to do it for himself. So I know there are people who are in this situation perennially, all the time, every day, 24/7, where the person they're caring for feels guilty. And I know he felt it. I was a kept woman for 30, what's 52 minus 16? 40, 36. Anyway, I was a kept woman. I didn't put gas in my car. I didn't open my door. And all these things that he did for me, he was not able to do anymore for me. And I know it bothered him to see me pumping my own gas. I know it bothered him seeing me taking out trash and garbage. And he felt bad. And I didn't. I was born for this. I've been a caregiver for 35 years to many family members, to my grandchildren, and to my son, and our son. And so, and I told the Lord, I said, if you give me this man, I don't care how many pieces you take off of him, if I could have his head in a handbasket, I was going to be happy. And so I could go on like this for the rest of his life or mine. The only limiting factor is I'm getting older, and I feel a lot more on me physically now, and my health than I did 16 years ago. 16 years ago, I was only 58 years old. I was still kicking high and squatting low. Yeah, baby, I was. Yes, sure I was. Yes. Anyway, so now I get that leg up and I can't get it down. So I realized that, and unfortunately, Hamp is going to need care for the rest of his life. Eventually, I'm going to need care. I was able to get long-term care insurance. He could have gotten it, but because of his pre-existing conditions, it was so expensive, we lost our house. And so we decided, because since he's a veteran, we knew push comes to shove, he could go to a VA home. But for me, I knew I needed some out, because I did not want our children to be taxed with us. And that brings on another point that you'll see in many ethnic communities, is that they exude the promise. And the promise is, please don't put me in a nursing home when I get old. You know, I want to stay home as long as possible. And I know that people.
Thanks for sharing, or thanks for facilitating the video, Joey. So I just love the Conways and their story, because they cover so much, right? From sort of the impact of assisting with activities of daily living to later in the video, she talks about racism and aversions to being put into long-term care facilities and how there are cultural considerations around that, and historical access and lack of access. She talks about the cost of long-term care assistance, veterans issues, just really humanizes how difficult and also rewarding the experience is, especially recognizing, as she does, that, Hampton was able to recover from that surgery on his one arm, but for many folks, they're caregivers for people who have chronic conditions that will never recover their independence. So I love sharing their story, and also just how much love and joy they have. So glad y'all were able to just see a little glimpse of their experience as caregiver care recipient. And the Conways were just two people to share their story with us. Over the past several months throughout the pandemic, we at the Diverse Elders Coalition have been hosting ongoing resource sharing webinars with caregivers from the communities that the DEC serves. And in all of these webinars, we've surveyed more than 300 family caregivers to older adults. And what we heard from them was some of the data that you see in front of you. So some of the top challenges that caregivers from the Diverse Elders Coalition's communities faced were anxiety and increased isolation under the categories of mental health and social isolation. And also a fair number of folks, a little more than a third, expressed that financial strain was a really big concern and challenge for them. So people really wanted, people felt like it was a challenge and difficult to take care of themselves and to prepare for the future financially. We know from our original research with more than 1,200 caregivers from diverse communities that caregivers are accessing formal services in much lower numbers than other folks, and that they may also be relying on informal services. So they might rely on their personal network or community-based services rather than formal services they may be eligible for, such as food stamps, for example, or cash assistance. 43% of the caregivers we spoke to wanted increased emotional support, which is also complicated when we think about emotional support and how that can look. And for a lot of the communities that Diverse Elders Coalition works with, there's a really big stigma around accessing mental health services, therapy, et cetera. So people are dealing not only with just traditional barriers to care, such as navigating the healthcare system, having insurance, language access, but also with social stigma against mental health or emotional support services. And then finally, 43% of folks also noted that they would like financial assistance, both in their caregiving role and just in paying for sort of daily costs. So all of that is from pandemic era surveying. Next slide, please. In addition, we just like to mention, because I think it's very easy to report back on the caregiving experience as kind of a collection of things, worrying about financial strain, feeling overworked, feeling too tired, but there are also a lot of positive experiences, and our communities are very resilient and practice community interdependence. So we'd also just like to highlight that the pandemic did have some benefits for people. So a lot of the cultures that people come from really value time with family, which a lot of cultures do, but 55% of respondents noted that they were able to spend more time with family. 48% of people enjoyed having decreased commute time during the pandemic. And then as we know, social isolation has been a really big issue over the course of the pandemic. Notably, 44% of caregivers were able to learn or use new technology. And we'll talk about it in the last slide. I think there's a link to it, but all of this is covered in a recent report that we released to Congress around caregiver experiences for diverse older adults throughout the pandemic. And I believe the next slide is not mine, but I'll just say next slide too.
Great, thank you, Lauren. And we will go to one more slide. Thank you. So, so we've thrown a lot of information at you today. We don't expect you to memorize it all, but we do want you to know that there are resources available in many different ways on many different websites. So the member organizations that Lauren and I work with through our work, they have resource libraries of their own. So if you're particularly interested in different diverse populations, so for example, right here we have screenshots from NYCOA and from SAGE, and these are just some examples of their resource libraries. You can access all of them, and you can find them all listed on the OAEC resource library. And there are also, many of them are listed on the Diverse Elders Coalition website as well. Joey, just click once. And I also just want to give a shout out to Dr. Sullivan, an organization that Dr. Sullivan is the chair or the president of, called the Citywide Behavioral Health Coalition for Black Elders. It is focused in New York City, but it is just another example of an organization doing the work that we're talking about with lots of resources. Their website is currently down, but if you click on that link, it will take you to an email, and you can email and find out more. And I will go to the next slide, please. And then if you're interested in kind of diverse older adults, but from a kind of more of a topic perspective, our resource library for the entire collaborative is organized by topic rather than by type of population. So you can see here, this is just 6 of the topics that we have. We have many more than that. So you can see, for example, Alzheimer's and dementia, disability, COVID-19. Each of those different categories have a number of different resources that we culled from the various organizations that we work with, as well as other resources and from the Administration for Community Living. And we encourage you to check that out. There's toolkits, there's research papers, there's different AV resources, and we hope that you will go there as well. And I just want to make one note that I actually just saw this morning that the United Hospital Fund just published a paper or an essay called Language Access Equity, a roadmap for improving care for language minority patients. So I'll try to remember to send that in the follow-up email as well. And I'll put it actually in the chat. And I just encourage you to, there were some good advice there and related to language access. So I just put that in the chat there. And Lauren's going to wrap us up with this last slide, and then we will take questions. So please, we're unable to unmute the audience, but we do encourage you to put questions in the Q&A. But Lauren, wrap us up on the next slide.
Great, thank you. So just some of the resources we have available. So our Caring for Those Who Care toolkit was based on research we conducted in 2018 with more than 1,200 caregivers from our communities in 8 different languages. So it's pretty robust and has a lot of different caregiver resources that for things that we think providers should know or would be useful for providers who want to provide more culturally adaptive or culturally culturally supportive services for family caregivers. And then finally, we have our Family Caregiving and Diverse Communities report, which is sort of an update on the toolkit, because it incorporates data from our 300 different family caregivers and from their experiences during the pandemic. The report on the right also synthesizes, if you're familiar with the Raise Family Caregivers Act, it also ties together some of the implications of this research and some of the ways that the Raise Family Caregivers Act implementation plan could be more inclusive and supportive of diverse caregivers.
Great, thank you. Next slide, Joey. So we hope that you will follow up with us if you have questions or comments or resources for our various resource libraries. We always welcome that. You can, of course, follow us on Twitter. I did not mention this before, but at the Center for Healthy Aging, we have an Image NYC map, which is an interactive map of aging. It is of New York City, but we are talking to many other cities and locales around the country for doing creating a similar type of interactive map in their areas. And we're happy to talk with you about that as well. So we do have a couple of questions, but I first just want to see if Dr. Sullivan wants to respond to anything or give us any comments.
Yes, thank you, Elena. One of the things I was wondering is, we know that particularly for families of color, and it was mentioned, I think Ms. Pongram mentioned it, people don't identify necessarily with the term being a caregiver. They think that they're doing what a wife or a daughter or, does. So I just wonder if you feel like there's any progress, I guess is the word, in that area. Are people sort of connecting with this notion of being a caregiver more? Because of course it has to do with then accessing the services that do exist for caregivers.
Lauren, do you want to take that?
Lauren, I'm sorry.
Sorry, I thought I was clicking the unmute button and I was clicking the chat. I just had a conversation about this yesterday with regard to sort of the narrative change work that needs to happen nationally, I think, around helping people self-identify as caregivers. We see that in a lot of different languages, there's no word for caregiver, there's no real translation. But what we've done on some of our forums, so for example, for the series of webinars we did aimed at family caregivers for diverse older adults, we made a really inclusive definition. So we said, like, click here if you provide care, parentheses, financial, emotional, or daily, or assistance with daily tasks to an older adult. To try to, if people don't identify with the word caregiver, to try to help to get them to self-identify. But I think you're absolutely right that there really is sort of a lack of that identity. I think one thing that's been helpful is, even thinking about the last presidential campaign, we had candidates for the first time talking about the role of caregivers, and the care economy. I think while the care economy sort of sounds kind of esoteric, I think more and more people are learning to talk about it and understanding that there's real financial and workplace ramifications for not supporting caregivers. So I think it really is entering sort of the national conversation, but I think it'll be several more years before it's sort of a household vocabulary word.
Thank you, thanks.
And I do see one question here. Should intake forms be designed to respect confidentiality for those who may not feel comfortable answering certain questions by keeping non-essential questions optional? And also, could definition of the term family be accurate as well as inclusive by adding friends or neighbors or something else as a separate category, not to be confused with family members? I would say absolutely to all of those comments. I think in terms of confidentiality, I would hope that healthcare providers have good systems in place so that the information is kept confidential. So if it's important for the provider to know, but for other people to not know, that there is a way of doing that. But I do think not only in terms of confidentiality, but just in terms of, those forms can be exhaustive and confusing. And so to also, and I mean, I still can't quite believe when I go to a doctor's office and it's a kind of a copied over, 700 times form with the questions kind of tilted, and many questions that often are not, at least I don't think, are particularly relevant to my care. They may or may not be, but again, this may just be an opportunity to look at the questions that we are asking and seeing if they are necessary or not. And yes, so the question about the definition of family, as I alluded to earlier, it's good to kind of, and it also kind of relates to what we were just speaking about, to thinking about different ways that people see themselves as caregivers, which may not be that term. So to kind of prime people by saying, family, friend, neighbor, like nothing else comes to mind, but there are many other terms that we can think of to make it as wide of a definition as possible. Are there any other questions or comments that you want to put in the chat or the Q&A? I did see one other question. Do you know of any other organizations, nonprofits, or advocacy groups that focus on the needs of family caregivers? And I will just say sometimes also, there's family caregivers. Sometimes we say informal caregivers, unpaid caregivers. There's also a lot of work being done with paid caregivers. So you also just want to make sure that we're kind of, knowing which terms and which types of people we're talking about. I would say that the first couple that come to mind are Caring Across Generations is one that's doing impressive work around the country. And then also the Family Caregiver Alliance is another one. Lauren or Dr. Sullivan, are there others that you can think of that people can
Yes.
get resources for?
Here in New York City, there's Caregivers Empowerment, Inc.
Oh,
Large, very supportive. It's a great organization.
great. I'm going to write that down. Thank you.
The National Alliance for Caregiving also does work with caregivers of all types, so family caregivers, paid caregivers, et cetera.
Great. Wonderful. Has Diverse Elders Coalition have any info on spiritual or religious diverse-based supports, especially for African-based religions, spiritual or agnostic identifying caregivers? That's a great question, Terry. Thank you.
Yeah, thank you for that question. In some of our, we have some resource lists for specific organizations, but we do recognize through our research just how different groups are more comfortable working with faith-based organizations. So we don't list any specific, churches or mosques or other religious institutions or faith-based institutions that provide those supports, but we definitely recognize that a lot of caregivers from our communities prefer, that's where they're comfortable going for services. And so we recognize that some of the best ways to reach caregivers or to refer them for other community supports is through local faith-based organizations.
Great. We have a few minutes left. I'll give us a moment of awkward silence in case anybody else has a question to type in or to put in the chat. Oh, it worked. Are spirituality questions listed on intake forms? Dr. Sullivan, you work in a healthcare setting. Do you want to answer that one?
We do actually ask about issues of spirituality and religion, particularly in an inpatient setting. We are required to be able to respond to people's faith.
Yeah.
And our setting is also an intermediate care and sometimes long-term care. So we have chaplains, and it's actually our responsibility to see that we also respond to people's religious and spiritual needs. So actually we speak of our work as using a biopsycho social spiritual approach.
Oh, interesting.
Yeah.
Yep. Yeah, that's a great question. Thank you. And how can we engage with you individually or through our community organizations? We're going to be sending out the PowerPoint slides in the last, I'm sorry, there's a second part of the question. How can we engage with you individually or through our organizations in developing policy and advocacy interventions So this is the kind of work that we do all the time. And I think I can speak for Lauren as well and say that we're happy to follow up with you to kind of talk more specifically. And when we send out the slides, you'll see our contact information is on the last slide. And we would love to talk with you more about this. There's a lot of work happening right now on various local, state, and regional and national, federal levels as well. Okay, well, I think if there are no other questions, I just want to thank my fellow panelists, Dr. Sullivan and Lauren Pongin, and thank you all for joining us at the end of your, or for some of you, depending on your time zone, the end of a workday, for others in the middle. And we hope that this will be the beginning of a conversation, and that we'll see you at another webinar soon. Thank you so much.
Thank you.
Thanks, everyone.
Thank you all. It's great.